Hi, I'm Leah Archer, and I'm one of the co-founders of Aphasia Relearned. I'm also a physical therapist. I got my physical therapy degree at the University of Puget Sound in Tacoma, Washington. I wanted to talk about neuroplasticity, and that is what we are basing our underlying foundation for Aphasia Relearned on. You may have heard about neuroplasticity as cognitive behavioral therapy when someone wants to change or form a new habit. When a person has a stroke, they have a part of their brain that gets damaged. This tissue may never come back, but they also have surrounding tissue that is bruised, and then the rest of their brain is healthy tissue. What we're trying to do, and what neuroplasticity does, is it creates new neural pathways. So we have this damaged part, but that bruised part we can also use to create new pathways in which to form speech. So there's Wernicke's aphasia and Broca's aphasia. Broca's aphasia is what Kent has, and that is when the brain is working correctly, but the words have a hard time coming out. So what we liken it to is a rough and dirt road that Kent must travel along to have his speech come out, where most commonly we all use an interstate system. So Kent has the words, they just have to go along a different route because of that part of the brain that is damaged. And with aphasia, either Wernicke's aphasia or Broca's aphasia, the science out there does demonstrate that there is no cognitive decline. It's just difficulty either receiving or expressing your speech. After a stroke, people are told that the recovery and the rehab phase is 3 to 6 months, and then they will plateau. The science is out there, and we have found that neuroplasticity can go on for 5-10 years, and most likely indefinitely. When we apply stimulus to the brain, then the brain will get stronger and meet that stimulus and continue to repair the roadway or the neurons. In order for the brain to grow, you need to apply a stimulus. It's the same way in physical therapy. If we were to do a bicep curl and only use 3 pounds, we would never get any stronger. But if we continue to increase our reps and push our body, then we can get stronger. And it's the same way with speech therapy on building neural pathways for aphasia. When people attend an intensive comprehensive aphasia program, the speech therapist applies stimulus and challenge that person in such a way at their level, no matter where they are in their rehab, to develop those pathways so they relearn how to speak at their level and continue to grow. One of the things that can happen with neuroplasticity and the rehab process is called decompensation. So if we go back to our analogy of a dirt road and compare it to an interstate as we're forming these new neural pathways, a dirt road can only handle so much traffic, where an interstate can handle a lot of traffic. So there are times during the rehab process and the recovery process where you will have a decrease in your learning because you are taking on too much traffic. So you need to allow for the brain and the body and the mind to recover, and then you go back at it. So that old dirt road can eventually become an interstate as long as the work continues.